My name is Simon Ezban Grützmeier, and I'm a medical doctor from Copenhagen University Hospital, Herlev, the endoscopic division of the gastro unit. First and foremost, I would like to thank GIE for the opportunity to discuss our research titled Endoscopic Ultrasound Guided Biopsies versus Surgical Specimens for Establishing Patient-Derived Pancreatic Cancer Organoids, a Systematic Review and Meta-Analysis. I would also like to thank my co-authors for the immense work they contributed to this publication and for the support they have provided along the way. This study was conceived and designed based on our own experiences with establishing and culturing patient-derived tumor organoids, or PDTOs. PDTOs, they are a new three-dimensional cellular culture model with a wide array of potential applications, including use in precision medicine. By using these 3D cultures as tumor avatars in the laboratory, they may be used to predict patient response to various kinds of therapies. However, to evaluate their clinical applicability, having an estimate of the expected success rate of establishment is crucial. However, the success rate, it varies immensely between studies, from less than 20% to more than 80%. Furthermore, many attempts at establishing PDCOs from pancreatic cancer used tumor material derived from surgical specimens. But as we know, the majority of patients with pancreatic cancer are inoperable at the time of diagnosis. So having the ability to establish these cultures from biopsy material is crucial if patients are to benefit from this technique. So this review, it focused on determining a weighted estimate of success rate of establishing these PDTOs and given the available evidence. And we also wanted to investigate if EUS-guided biopsies are an effective method of acquiring material for PDTO establishment. Comparison between studies have traditionally been difficult due to differences in methodology, culture techniques, and what success criteria is employed by various studies when defining what constitutes a successful organoid culture. Something that makes this even more tricky, or comparison even more tricky, is the risk of contamination of benign organoids, which may be indistinguishable from organoids from cancer origin. And not all studies, they take equal measures to avoid this from occurring. To address this, we stratified studies based on the apparent success criteria they used. Some studies, they employed extensive characterization to ensure the malignancy of organoids, whereas others, they simply counted the appearance of organoid structures in the culture as a successful culture. We also noted what kind of medium were used. Some studies, they used culture medium deprived of key growth factors, which are necessary for the continued growth of benign organoids to reduce the risk of this kind of contamination. To take both medium composition and success criteria into account when evaluating the risk of contamination of benign organoids in occurring, we developed a classification scheme we called the Strength of Validation Score. This characterized studies, or classified studies, as either having high strength of validation or low strength of validation, depending on success criteria and what kind of medium they used. We screened more than 1,500 unique articles and abstracts during this systematic review and meta-analysis. We found 24 studies which provided sufficient information on success rate to be included in the end. Included studies recorded attempts at establishing PDTOs from 1,053 procedures totally. The pool success rate was 63% across all studies. We then investigated the potential impact of using EUS-guided biopsies compared to percutaneous biopsies or surgical specimens. The pool success rate for PDTOs established from EUS-guided biopsies were 60% compared to 62% for those established from surgical specimens, and this was not significant. This was replicated when we tried constructing a multivariate meta-regression model where tissue acquisition method was not a significant variable. Likewise, we did not find any significant difference between tissue acquisition methods in studies that used both EUS-guided biopsies and surgical specimens. We also looked at whether the success rate differed between studies using different success criteria or studies being classified as having either high strength of validation or low strength of validation. While studies that had less stringent success criteria reported higher success rate, the difference between groups were non-significant. Likewise, studies that were characterized as having a low strength of validation reported higher success rates than those characterized as having high strength of validation. They reported a lower success rate, but again, this was non-significant in univariate subgroup analysis. However, it is an indicative that some overestimation of success rate may occur if there's insufficient validation of the malignancy of PDTOs. The pooled estimate of success rate was 63%, which we consider compatible with clinical implementation. Our results also suggest that EUS-guided biopsies are equally effective as surgical specimens when acquiring tissue for PDTO establishment. This bodes well for the potential of clinical implementation, but it was slightly surprising to us. While there have been large improvements in US-guided tissue acquisition lately, there's still far more tissue available when using surgical specimens. We hypothesized based on our own experiences that the larger and more chunky samples that can be acquired from surgical specimens may require an increased amount of tissue processing and more enzymatic digestion prior to seeding cells as organoids, and this may in turn reduce cellular viability. In any case, our results are encouraging, and we hope that the design of future trials, including PDTOs, may benefit from them.